Joining us today to talk about the new normal getting healthcare is Cheryl Fallman. Cheryl has over 30 years of experience as a clinician and researcher in health policy, focusing on a variety of areas including cost, access, and quality of care. Her research work has focused on developing and validating healthcare quality measures across different types of care. She has worked in a number of large research organizations that work with Medicare, Medicaid, and private insurers. But her most important work has been helping people steer their way through the healthcare system. How are you doing today, Cheryl?
Fine. How are you, Jason?
I'm doing well, doing well. Thank you for joining. What is this? I think this is our fourth webinar together. So we are
Yeah, something
racking them
like
up.
that.
Yeah, you're doing amazing things, and we appreciate you being a part of the Knowledgeable Aging webinars. Before we get started, Cheryl, for those that are joining us for the live webinar, if you have any questions, type your questions in. Time permitting, we will do everything in our power to get your questions answered. So Cheryl, I'm going to turn it over to you, the new normal getting healthcare.
Okay, thanks, Jason. Well, welcome everyone, and I hope that you find this an interesting presentation. And I'm sure that everyone can relate to this. Over the last year, or last 16 months actually, things have changed greatly, and it has probably been almost a year since you've seen your healthcare provider, right? So what are we going to talk about today? We would like to help you manage how you see your healthcare providers. So, what are some of the things that you might need to know when you go see your provider for the first time? What happens if, God forbid, you have to go to the hospital? And most importantly, what are some of the risks of delaying care? So, you know, as I said, I haven't seen my doctor in a while, and you may be in the same boat. But now that the pandemic restrictions are easing up, people are trying to schedule an in-person doctor's appointment because they've had to put it on hold for so long. So, I mean, that length of time, that puts a lot of pressure on you and your doctor to catch up on your health status because it may have changed during the last year. Um, and given that the average appointment is only 20 minutes, you'll want to make the most of your allotted time. So here's a few tips for you, some before you go and some while you're there. So first of all, get vaccinated. Um, you, if you're not vaccinated, I am sure your doctor's office will vaccinate you if you indicate that. Um, please wear a mask. As of right now, you are still required to wear a mask going into a physician's office or the hospital. So if you want to make the most of your visit, see if you can ask for a longer appointment, because you may have a long list of symptoms or concerns, and you tell the receptionist you have a lot to talk about and that you'd like an extended appointment. If you can't get that, it may be helpful if you schedule a virtual visit ahead of time. And so it's like a planning visit. It'll help you decide with the doctor what the most important issues to talk about are during your in-person visit. Um, and take care of what you can ahead of time. Oh, sorry, I went too far there. There we are. So you can find out ahead of time if there's any blood or imaging tests that you can have done so that you can talk about the results at the visit. For example, if you have diabetes, you can have your H1AC done ahead of time, and they'll have the results and you can talk about it then. And you may have other screening tests like breast cancer, skin cancer, or colon cancer to catch up on. Researchers found that during this time of the pandemic, screening went down by more than half, and at imaging centers. And some places, and for some screens like mammograms, they dropped by over 90%. So that's an awful lot. The other thing you can do is update your health information on the patient portal. So you can update your list of medications because you may have had virtual visits during this past year where you got other medications. So you include your prescription medications, your over-the-counter drugs, vitamins, any nutritional or herbal supplements you might be taking. And then you don't have to spend your time in your doctor's appointment going over all of this information because they'll have it ahead of time and can review it. And if you have something like hypertension or diabetes and you have the equipment at home, you can measure your blood pressure or blood sugar regularly for a period before your visit. And so you track your numbers, you write all your numbers down, you take it with you. And that way the doctor can have an idea of what's happening with those conditions over time rather than just getting one visit when you're in the doctor's office. If you're like most people, your blood pressure is higher when you're in the doctor's office than when you're at home. So it's always better to review that stuff when you're at home. Okay. So now you also need to think about it. If you only have 20 minutes, you got to really think about what is important. So before you go into the appointment, create an agenda of what you want to talk about and identify the top 3 to 5 concerns that you want to talk about. And then you start the conversations with those items. And if you don't get everything covered in one visit, you ask whether you should schedule a follow-up or, can you discuss it through email or would a virtual visit work? So be open with them about that. Now, the other really important thing is, for many of us, it has been a long and stressful year, and we've been through a lot. You need to be really specific about what you're experiencing. So, if you're describing a symptom, you can't just say, oh, my stomach aches. I get indigestion every time I eat. So that likely isn't every time you eat, but it may be related to what you're eating and how you're eating it. So, do you eat everything? Do you scarf it all down and is done in 5 minutes? Is it all fried? So think about these things. And when you're describing these symptoms, be sure to tell the doctor how it feels, when it started, what makes it better or worse, and how it's affecting or interfering with your life. And this is really important. Don't limit it to just physical symptoms. In the past few months, many people have experienced mental health symptoms such as depression or anxiety, and you may not feel comfortable bringing it up, but tell your doctor. Remember, your doctor wants to help you, and they can only help you if you're honest with them and you tell them everything. And mental health issues can affect other things. So make sure, like, it can affect other parts of your health. Make sure that when you talk to the doctor, you say, I've been feeling sad, or I haven't been sleeping well, or I've been sleeping too much. These are all things that they need to know. So, and the other thing, and I will be honest, I don't know about you, Jason, but I'm not always honest about my lifestyle habits.
No
In
comment.
particular, all that Kentucky Fried Chicken, right? But so in particular, you really need to talk about your diet, your use of alcohol and caffeine, and how much you exercise. And has this changed since the pandemic started? I mean, I don't know. Some people drink more coffee now because they're sitting at home in front of their computer all the time versus, going out into an office or to see other people. So make sure that you talk to your doctor about this. It's important that they know these things and these changes, but what's happened over the last year, because those can also influence your health risks and your health conditions in different ways. And, you know, if you've been eating out more or exercising less, you're just one of many people, and I'm one of those. I'm one of those people. Um, people, researchers have found that, especially early in the pandemic, um, people increased, high calorie food, salty foods. My personal weakness are potato chips. Um, you know, you sit in front of the screen for more, you for longer and more frequently than you did before. You might use tobacco or alcohol or even marijuana. This is all, these all have increased over the past few months. So tell your doctor there's nothing wrong with doing this. Um, and those stay-at-home orders, while they were really important to help contain the virus, they weren't so good on the physical activity. And, a lot of people gained weight, and I can raise my hand on that one. So you also need to understand what you're being told, because for most people, when they go to the doctor, it kind of sounds like the adults in the Charlie Brown shows, wah 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 wah. They talk over you. So you bring a paper and you bring a pen to the appointment so you can make notes. You can ask someone to go with you to the doctor's appointment, and they can take notes. And if you don't understand something that the doctor says, ask questions until you understand. um, and make sure that you understand what the doctor is saying, including recommendations for treatment and why it's important. Okay, you review the doctor's advice about medications, additional testing, lifestyle changes, and the one trick that a lot of people find really helpful is something called teach back. So the doctor will talk to you about a new medication, and then you talk back to the doctor in interpreting what he said. So, for example, if the doctor says, you need a new medication and you're to take it 3 times a day, um, you know, that's fine. The teach back may be something like, okay, I'm starting a new medication. I need to take 1 tablet 3 times a day, and it may be morning, noon, and night. But if you notice, what the teach back was slightly different than what the doctor might have said. So, but it helps the clinician know that you understand what they're trying to tell you. And really important, before you leave the doctor's office, talk about sort of implementing recommended changes. How can you prevent a chronic condition from getting worse? Because for many people, it has over the last year. Do you need any additional follow-up lab tests, imaging procedures, visits to a specialist or a therapist? Um, you know, every visit should end with some kind of guidance in terms of when you should touch base again, or if there's red flags that you need to watch for. And my guess is, going forward, visits are going to be much easier with your physician, because you'll have an option of doing virtual visits or phone-based visits, or even in person. So you'll have a little more variety. Now, the other thing, and I will say I'm guilty of this, almost half the people in the United States said that they stopped going to the dentist during the pandemic. But dentists have made huge improvements in COVID safety because they work so closely with a
Mhm.
person's mouth. Yeah. So don't forget to see your dentist. It may have been a long time since you've seen them. It is time to go again. You know, and if you're hesitant, ask questions, go visit, see how they set it up, for COVID. Um, and if you're still uncomfortable, depending on where you live in the country, there may even be mobile dentists who will come to your home for routine care. So that may be another option if you're interested. Okay, so what if something happens and you have to go to the hospital? What do you do now? Okay, going to the hospital was always kind of scary before COVID.
Mhm.
And now it's a little more scary because that's where sick people go. And as I mentioned before, get vaccinated before you go into the hospital, either as a patient or a visitor, because this is where they treat COVID. You want to protect yourself as much as you can. And it is mandatory that you wear a mask in the hospital. And many hospitals are really specific about the type of mask. So they do not let bandanas and scarves and those clear shield like face masks or even vented masks. Those are not allowed. And if you don't have a mask or you have one of those kind of masks, most hospitals will actually provide you one. So they won't let you through the door without it. Now, the other thing is, if you've had COVID, because there have been millions and millions of people in this country who've tested positive for COVID. So if you've had COVID recently or you still have symptoms, like you're a long hauler, talk with your doctor about the risks of the surgery. There is some research that is showing there is increased risk of complications after surgery if you've had COVID-19. So make sure that you have a frank discussion with your surgeon about whether the surgery is needed, and if you have had COVID, what are the risks for you? Okay. So the other thing you can do, and I know a lot of people who are doing this now, is ask if the procedure can be done as an outpatient or in an ambulatory care setting. That way, you don't have to stay overnight. Right now, almost half of all knee replacement surgeries are now done as day surgery. So you're in and out, no overnight stays anymore. So ask if your surgery or your procedure can be done that way. You know, if you can have it done that way, the people who come with you are generally not permitted to wait in the waiting room because of social distancing unless there's a big enough area. So they may have to leave the building or move to a different area, just so you know that ahead of time. Now, the hospitals will screen you and your visitors for COVID-19. It's just, even though you may be vaccinated, there is still a very small chance you can get COVID. And if you get it, while you may be vaccinated, it's likely to be very mild or even asymptomatic. But there's a possibility you can spread it to other people. And as I said earlier, hospitals are full of sick people, so they don't want COVID any more than you do. Usually the screening is what we've seen over the last year. It may involve a temperature check, a verbal screen with someone in the admitting room, or some hospitals, like I know Johns Hopkins Hospital, has an app where you report you report in and it sends the results in and it clears you. So hospitals will screen you. Now, if for some reason you are admitted to the hospital, many hospitals now limit the number of visitors or support people that can be there at one time. For example, an ER might be limited to one person, but a medical surgical unit might have two people. So it would depend on the hospital, and it depends on the unit you're in. I know that it's a lot of depends. And also, visiting hours have generally been shortened from pre-pandemic times. So make sure you check with the hospital before you go in so that you know your options of, you know, visitors and or support people. Okay, so what are the risks of delaying care? And I mean, everyone can answer this question if, like me, you broke your wrist and if I had delayed care, I probably wouldn't be able to use my wrist. So I went into the urgent care center. But for some things, it's not as straightforward as that, especially for chronic conditions like hypertension or diabetes. Now, for decades, you have been told not to delay or miss any types of care because of because there is a risk of negative consequences. But because of COVID-19, they were saying don't go. At first I was told don't go. You go only for essential services. And anything that was elective was to be postponed. So these decisions have made people rethink how they access healthcare over the last few months. But for over a year, we've been told not to go unless you really needed in-person care. But now we're at the point where we can go. And in the meantime, when they told us we couldn't go, there was telehealth, which some people used and some people didn't. Um, and that's there are issues associated with that. It's great, but there's unequal access. And there's some things that just can't be done via telehealth. Heart disease, cancer screening, diabetes. You know, really tough to do a mammogram or a colonoscopy via telehealth. Those need in-person care. So along with exacerbating existing health problems, the pandemic has caused a whole host of new medical concerns in patients. The American population is coming out of the pandemic with, dental issues, back problems from slouching over a computer, mental health problems because you're in isolation. And while you love your family, you may have had too much of your family. And no one really knows what the long-term effect of delaying all this care is. Doctors are now reporting seeing patients who are more severely ill than if they had come in earlier because people missed things like mammograms. So when breast cancer is now diagnosed, it is at a much higher stage and carries a greater risk of complications and death. So, patients may have stopped medications for example, treating glaucoma, which could have a longer term impact on the loss of sight. So these are all really important things that you need to weigh, and I would strongly recommend if you need to go to the doctor, go. Get involved with all of those screenings that you haven't had in the past year, and don't forget to see your dentist.
Ambulatory care.
Mm-hmm.
How do you describe that? What is that for individuals that are unsure? What the value is to them as far as a patient?
Okay, that's day surgery.
Okay.
So basically, you're in and out, and in many cases, it's actually cheaper than being in the hospital because you don't have to pay the facility, like you don't have to pay all the hospital co-pays. But yeah, you're in and out, and it reduces your risk. You go in the morning, and you're out generally sometime in the afternoon, and you can recuperate at home.
Yeah. You had mentioned that in hospitals, it is masks are required. Somebody asked, is that a national mandate?
It, yes. So there are still some places where masks are required. For example, airplanes, hospitals, um, long-term care facilities. So there are still some places, even if you're vaccinated. And that's primarily because there is a population in those facilities that is at much higher risk, even if they have been vaccinated, just because they're sick.
Okay. So you just briefly touched on, obviously, with the risk of delaying care, Cheryl, with regards to telehealth and in person. So if somebody doesn't have, or if it's just maybe a regular checkup, do you think that telehealth it might be better for them as opposed to going into a face-to-face appointment?
Well, okay, this is something you have, as a person, you have to weigh. If you missed your regular checkup last year, it will have actually likely been 2 years since
Hmm.
you saw a doctor.
Gotcha.
And in that case, I would suggest you go in person just because 2 years, 2 years, a lot can change. And there are some things that are still better done in person.
Question for you about bringing family members
Hmm.
to a doctor's appointment.
Hmm.
Do you have to let the doctor know ahead of time that you're bringing a family member with you, or potentially a patient advocate with you to an in-person appointment?
Generally, no.
Okay. I guess just curious, somebody asked about HIPAA, that maybe the doctor might disclose something about a family member in front of another family member, just the concerns there.
Yeah, and that's a valid concern, but the person you bring in, you need to be able to trust them.
Okay.
And as part of a HIPAA waiver, in all of that paperwork, I'm sure, which most people don't read, one of the things that they ask you is if they can disclose health information to someone else.
Okay.
So you can, if you're concerned about that, you can sign that waiver for that visit for that person.
Okay. Now, how does it apply then, Cheryl, if somebody has a family member that's listening in from another location? Is it the same applicable as far as the
Yep,
waiver? Okay.
yep, yeah. And I mean, that depends on your doctor. Some doctors will do it with a verbal waiver. If you feel more comfortable, you can have the official paperwork signed.
How does somebody go about finding a patient advocate in their area, maybe to go with them to the doctor?
Okay, so it depends on what you're looking for. There
Okay.
are a number of organ so many home care agencies will can send someone. There
Okay.
are companion services that can send someone. Um, with the home care agencies, the people they would send usually have their home health aides, so they
Okay.
might have a little more background, and they certainly understand the concept of HIPAA.
How can people find you, Cheryl?
Okay, so I am Cheryl Fallman, Fahlman, and I am the president of a company called Sincere, Sincerae. You can reach us. Our website is www.sincere.com. So www.sincerae.com. You can also reach us on a toll-free number, 1-888 697 6922, or you can email us at info@sincere.com. So INF as in Frank, O at S as in Sam, INCERAE.com.
Excellent. Thank you, Cheryl. This has been wonderful.
Okay.
Like you said, people need to they need to take charge of their health now, right? They can't just
Yep.
stay at home.
It's This is our new normal, and this is what life is going to be like now.
Yeah.
So You got to learn to work within those parameters.
Very good. Well, as far as Knowledgeable Aging, you can go to our website, knowledgeableaging.com. You can find all of our upcoming and archive webinars. Go to YouTube, type in Knowledgeable Aging. We encourage you to subscribe. We update that usually 4 to 5 times per week. If podcasts are your thing, you can find us on Apple, Tunes, Spotify, etc. Till next time, I'm your host, Jason Kotar, and this is Knowledgeable Aging.